Hello dear friends, today I'm going to describe a compression rotation technique for anti-clockwise rotation of the intraocular lens with the capsular bag, which can be very useful in toric IOL placements. This can be done very simply using a Sinskey hook itself. Now, a standard sharing design model of the intraocular lens has an optic and two open-ended haptics arranged in an inverted S type of manner. When implanted into the capsular bag, the haptics fit snugly against the equator of the capsular bag, the diameter of the bag being 10.5 and the overall diameter of the IOL being 12.5 millimeters ensures a snug fit of the IOL. For this reason, once in the capsular bag, the IOL can be effectively rotated only in the clockwise direction and will resist anti-clockwise directional rotation. Now, tilting the IOL within the capsular bag will relieve the equatorial stretch and enable the rotation in either direction. This is what I call the pivot rotation, but this video is not about pivot rotation. For those who find it too cumbersome to use the pivot rotation maneuver, dialing of the IOL at the haptic-optic junction will also work well for clockwise rotation of the IOL. But can we also perform the against the grain or anti-clockwise rotation with a simple Sinskey hook and with no pivot rotation at all? Let me show you how you can do that. I'm sure that many surgeons must have already figured this out and must be performing it routinely for the toric IOL placements. This is for those of you who haven't yet worked it out, and let's see how the technique goes. In the first case, I'm implanting the toric intraocular lens within the capsular bag. Once the lens has been successfully implanted within the capsular bag, we need to complete the task of aligning the toric axis of the intraocular lens with the toric marks made on the cornea. Now, this is the standard pivot rotation which I normally use. Tilt the lens, rotate it, adjust for parallax and put it into place. Pivot rotation is easy if you're using a coaxial IA for aspiration, but for bimanual IA and other techniques it may be difficult to do so. The alignment has been confirmed when the Purkinje 1 and 4 images coincide and the marks also coincide. Now let's take this particular example. The IOL has to be rotated slightly in the clockwise direction, and in so doing I find that I have actually overshot the mark. Now how do I rotate it in the anti-clockwise direction? Try to compress the haptic away from the point where you're rotating. This will release the pressure on the haptic that you're going to rotate in the anti-clockwise direction. This will help you to rotate it by a few degrees in the anti-clockwise direction as well. This is what I call the compression rotation technique, and the alignment has been perfectly achieved. Let's take a look at the compression rotation technique again. This involves holding the haptic-optic junction, compressing the lens towards the opposite haptic. This will compress the opposite haptic and free up the haptic that has to be rotated in the anti-clockwise direction. Once you compress it in this fashion, it is possible to rotate it in an anti-clockwise direction. So try this technique and see if it helps for your toric IOL placement. Thank you for your attention.